Good patient, good patient. You got a blood clots, surgical complications. So one of the most life-threatening, like sudden death, life-threatening complications of surgery is blood clot in your leg, blood clot in your lung. We call it officially pulmonary embolism if it's in your lung, or DVT, deep venous thrombosis, if it's in your legs or anywhere else, your arms also.
911, what's your emergency?
Because when you call your doctor, they just gonna tell you to come to the ER anyway. What the ER gonna do, child? What we gonna do? Another thing is hemorrhaging, but I'm gonna talk about blood clots. This is also important because some patients who travel a lot, you have long trips, any trip, flight, driving, that's more than, a few hours, you need to be moving around. You need to move. You need to move them toes, move those feet, move those legs to keep the circulation going. Okay? But unfortunately, surgery patients, it is common and it can also be prevented complication of blood clot. All right, so you've had surgery. Now what do you do? Because when you're in surgery, they're usually giving you, or they usually have already probably given you, depending on the surgery, prophylactic anticoagulation or blood thinner, if you will. Okay. They also have SCDs around your legs. So that's the equipment that's pumping your legs, keeping the blood flow going. All right. But after surgery, what happens? So you might be lazy. You might be in pain. You might not want to do nothing but stay in bed. And that's a no-no. That's a no to the no. Okay? You need to move. As much as it may cause you some pain, as much as it may aggravate things, you need to move. Okay? You need to move something. Even if it's a slight walk, slow walk, a little bit of steps. Because that's causing the blood to pump up your legs. Okay, we want to keep venous flow. We want to keep the veins flowing and pumping. Because before it gets to the lung, it starts out in the legs. And it starts out because someone wasn't moving a lot. They were what we call sedentary. So they just laying in bed, ain't doing nothing. And those patients that are really at risk for it, sometimes surgeons may go ahead and keep them on a blood thinner. However, that's a complication. That's a problem because you don't want them to bleed. You want the wound, you want the post-op area, the post-surgical area to heal. So you don't want that patient on no kind of blood thinner long term because it'll bleed out, right? And so sometimes that's the risk balance, of if this patient could be on or should be on something to prevent them. If they're going to be sedentary, if they are, baseline, meaning to begin with, they don't move a lot, right? If they have had blood clots post-op in the past, okay, those are when the surgeon may consider that maybe this patient is at risk and they should be on a preventative type medication to begin with. But most patients are not. So you ain't got no time to be sitting around there being lazy and laying in bed or sitting in a chair. You need to move those legs, okay? Get up and move those legs, all right? And that's to try to prevent. In front, the shin area, that's not where blood clots are. So some patients in front of your knee and then you go down, you're like, oh, I got pain right here in front in the shin. Blood clots don't go there. They don't travel. That's not the normal pathway of a blood clot. But that's not necessarily for you to know. If you develop calf pain, that's pain behind the leg, behind the knee, in the thigh, in the side of the thigh, into the groin, okay? If you have any swelling, if one leg is bigger than the other, even if it's just a little bit, those could be signs that unfortunately, maybe you have developed a blood clot in the leg. Okay, so when you have had surgery, you want to think about these things. Okay, you don't want to just think about the wound. A lot of people, they just like, oh, I look good, I got snatched, Oh yeah, that wound. Let me make sure my wound pretty. I don't want a keloid. I want this to heal pretty, honey. But you're not thinking about the complication and making sure you're vigilant of, ooh, I think I might have some palpitation. Ooh, I can't really take in a deep breath. Those are some of the other signs. So when you can't really take in a deep breath, it kind of cuts off, right? Or you have a little bit of pain when you breathe. You're inhaling, it's like, ooh, that's kind of sharp pain there when I'm breathing, okay? That's what we call pleuritic chest pain. I mean, it don't have to just be pleurisy, especially if you had something like surgery. It could be the sign that you might have a blood clot, all right? That needs to be evaluated. Chest pain, that's the kind of chest pain we usually patients have. They're not like, oh, you know, like heart attack kind of chest pain. It's usually associated with when you're trying to breathe. The other thing is palpitations. Kind of a tricky one, because sometimes people have like a faster heartbeat because they're not really drinking enough, they're not staying hydrated, they're not drinking enough water, you know, things like that. And so, you know, they may have a low grade temp or fever, and so their heart is already faster. But palpitations, what we call tachycardia, is a sign and a symptom that, oh, maybe this person has developed a blood clot, okay, in their lung. All right, so those are some of the things to think about besides just, oh, it looks good, I'm gonna be snatched. Hey, my wound looks good, it's pretty. No, are you having any calf pain? Are you having any calf swelling? Are you able to take in deep breaths? And this could be a week later. This doesn't have to be immediate. You know, you've probably been in bed. So don't just think, okay, I'm a week out of surgery, I'm okay. No, not necessarily. You want to stay vigilant. It could be 2 weeks out. It can be 3 weeks out, especially if you're not really doing your usual activity. Okay, if you're not doing your usual activity, then you are still at risk. Weeks away, weeks past surgery. Okay, especially, you know, you've been laying in bed or looking in the mirror all day. All right, pay attention to the body. Pay attention to those signs and symptoms. I'll do another video for people that do long flights, but I'll say it real quick. You are at risk for blood clots because you just sitting there. So you just sitting on the plane, your legs are like this, you cramped up, and you like that for what? 3 hours, 4 hours, 5 hours, 6 hours. You just don't move. You got to get up and move, okay? You got to get up and move and cause your veins, cause the blood flow to flow in your legs. Even if you just get up, stand up, stretch, get up, stand up, stand up. Even if you just get up, stand up, stretch, or even just point your feet, point your toes, feet down, back, This is your foot, okay? These are your feet. Down, up, down, up. When you do that, you're working those calf muscles, all right? And so you're causing the blood to flow, okay? And then you can be thinking about that wound and how pretty that wound gonna be and how snatched you gonna be, because we made sure you ain't got no PE. Yeah.
911, what's your emergency?